Dennis, you need to. Okay.
I'm unmuting. Yeah. Good afternoon, ladies and gentlemen. My name's Dennis Gilhooly. I'm here in Beijing, not Berlin. I was hoping to be in Berlin, but obviously events are mutating in real time, and but it's just great to join you virtually. We have an absolutely extraordinary panel here today, and we want to build on the great panel that we heard yesterday with Dr. Tedros. Bernardo participated, Sumia participated, Raj Shah participated, Sally Davis participated, and other colleagues in building what we believe is going to be the next step in the evolution of healthcare, which is digital health. Digital health is the future. Digital health is accelerating during the COVID pandemic. But I'd like to ask all of the speakers here today if they might, for 2 minutes, maybe 3 minutes, 2 would be good, if they could introduce themselves. So Florence, you're on the top of the screen next to me. So Florence Gadi Perkins, could you introduce yourself and explain your organization?
Yes, hello everyone, and hello Dennis and to our fellow speakers here. I have been very passionate about digital health for about 10 years now, and namely for what it means in terms of access to health, and I've been focusing a lot on lower and middle income countries. I came originally from the digital side of things. I was working with Alcatel-Lucent and built some multi-stakeholder partnerships, which I thought was the answer to scaling, but more on that later. It's not the only answer, but built breaking silos between health and ICT, both on the private sector, bringing in health insurance and mobile operators and other tech companies, working with governments and development banks, and specialized for a while on chronic diseases, and namely diabetes, and worked in Senegal and in Mexico. It's been a fantastic adventure. We keep learning in digital health all along. I've in the meantime gotten quite involved in what you call national digital health strategies, which are the roads which are so desperately needed today. And again, it's a great pleasure to be with everyone today to discuss what we think is a very important subject. Thanks.
Merci. Bernd, can you introduce yourself? Siemens Healthineers, I should say, is the leading health technology company in the world, and a lot of people don't know that you actually spun yourself off from the major company. In fact, so you have loads of money. So,
so thank you for that pre-introduction, Dennis. So yeah, Bernd Ohnesorge with Siemens Healthineers. I mean, as Dennis has alluded to, I mean, we basically, went on our own feet as Siemens Healthineers. I mean, we're still majority owned by Siemens, so we are a proud family member, as we say. We are happy with carrying the last name Siemens and first name Healthineers as a company, and assume this is going to continue for the foreseeable future that way. I am personally responsible for Europe, Middle East, and Africa, in abbreviation EMEA. And I mean, Siemens Healthineers, with the portfolio it provides, I mean, it's obviously a strong contribution in the imaging space, laboratory space, from point of care testing all the way to central laboratory tests. But the aspect of digitalization moves us, and digital transformation moves us tremendously. I mean, it is about contributing to digitalizing healthcare by means of increasing precision of diagnosis, of contributing to data-driven healthcare, by means of AI-driven decision-making from the diagnostics point of view, but also in order to individualize therapy options. And this also embedded in, I would say, technology that also allows telehealth aspects. So the virtualization of healthcare delivery And all those aspects move us as a company. We believe but not only us, all leading medtech providers in the world, I'm sure, want to have their contribution to that journey. And this, to some extent, or to a large extent, in the mature economies of Europe, North America, and others, but especially also to the developing and emerging economies, where digitalization of healthcare is just the same, of the same relevance, probably even with the opportunity to leapfrog the one or the other state where the developed countries still go through. So we look at this truly as a global undertaking. So thank you for having me on the panel.
No, absolutely super. Thanks, Bernd. Joanne, you're a fellow Irish person, as you know. I'm from the West Coast of Ireland as well. But Joanne, you represent the TM Forum, which is representative of most of the mobile companies in the whole world, I believe, or perhaps you could elucidate.
Sure, thanks, Dennis, and thanks for the opportunity to speak today. So yes, I'm the Vice President of what we call the Digital Ecosystem Initiatives at TM Forum, and TM Forum is a not-for-profit industry association. And what we've been doing is we bring together the whole ecosystem of suppliers and service providers and other stakeholders, which go beyond the ultimate customers, obviously, of the group. But what we do fundamentally is create the overarching principles, the guiding frameworks, the governance principles, the open APIs, the architectural designs, and things like that, all of the essential tools that are needed in order to create consistency, scalability, and interoperability across that whole sector. And we do it in a way that is what we say service agnostic. It can be reused in many different contexts, not just the telecommunications space. So recognizing that telecommunications is that foundation layer for digital health and many other digital transformations, we seek to share the knowledge. We've been working on digital transformation for a very long time, share the knowledge and best practice so that one, digital health can be accelerated, but two, more importantly, that we can drive the consistency, reuse the consistency, and learn by each other's mistakes. We have a very strong culture of cooperation and collaboration and co-innovation that we're happy to share and bring to the table and work with you so that the investments, we're hearing a lot about the investments of digital health that are coming to bear. What matters is that those investments are executed effectively so that the right value can be achieved. And, key aspects of that are overarching architectural principles, open digital architectures, common APIs, open systems, data governance, privacy, security, all these types of things. And we're happy to share the knowledge we have built up and which has revolutionized the interoperability and scalability in our sector.
Thanks, Joanne. We'll build on those points later on. George Fugao, you are George. So good to see you. Why is China actually managing the pandemic in a way that we cannot see the management in now Europe, but obviously in the United States? And we met in December last year in Shenzhen, and we didn't even know that the virus was actually existing. It has now become a pandemic of extraordinary proportions, historic proportions. But how has China managed this problem? And can you explain to our audience the nature of China CDC?
Okay, great, Dennis, and everybody, all my friends in the meeting here together with me in this room, because we are using room. I think the first, let me introduce China CDC. China CDC is a technical support organization for the National Health Commission. So we are doing advice, we are doing technical support, for the decision making for our government, for the public health, and also for some of the non-communicable diseases, control. So this is China CDC, somehow very similar to the US CDC. I'm currently is the Director General. I myself is a virologist. So I'm more or less on the lab-based work. I'm a lab person, but as a Director General, you have to also pick up a lot of technologies for the epidemiology and also management, all this. So we met, you are right, we met in last December. Let me start with when we met. I can't remember December when, which date, but
12.
Oh, 12.
I remember.
Good memory. So about 2 months ago, before we met, I was invited by the Gates Foundation and the World Health Forum, and also Johns Hopkins University. They set up a kind of event 201. There we call it table practice to presume we have a pandemic. That time, we presumed we had a pandemic. It's called CAPS, C-A-P-S. Go on to the webpage, you'll find this event 201 at CAPS. CAPS means coronavirus. The first is C, coronavirus. Second is A, associated. And the third one is P, pneumonia. Last one is syndrome. So coronavirus associated pneumonia syndrome. So this is exactly like the COVID-19. What I mean, though, when we met on December 12th, we didn't say we will have a virus like COVID-19 virus. But I should say, 2 months ago, 2 months before we met, I was in New York. We had this exercise.
I remember. I was in the meeting. You remember we had this meeting in New York.
Yeah, I remember. We met there, actually. We met there. I think maybe,
we did.
Yeah, some of the colleagues here, they were not here. So anyway,
it was,
I want to, Dennis, I want to remind you, though you and me, we met, we didn't think the virus will come very soon in the real world, but we know exactly, as a professional, yes. Me as a virologist, you as managers and for digital.
Well, I used to be a journalist. So
okay, journalist whatsoever. But we know a coronavirus pandemic might come. Now it's yes. Real. It comes, and also that also.
And as you know, George, Bill predicted this in 2015, and I was working on Ebola back in 2015. We knew this was coming. Yes. And also I can predict, because we couldn't find the origin of this virus. We will have another one very soon, because we don't know where this virus come from. And that means there might be sisters or brothers from this virus hiding somewhere in the latent state. We don't know. You believe there will be another one?
Yeah, you think, but because we don't know the source. So how can you believe only one? They are hiding somewhere and in the latency state. So there might be someone still, if you can find the source or the origin of this virus, you are safe. Because for 10 months, no one, we have been working so hard. We couldn't find any animal source or intermediate host. Maybe there's no such a host there. So i.e., the virus has already been adapted to human beings very well. If this is the case, this virus must have sisters or brothers somewhere, hidden somewhere. So this is why, anyway, this is the scientific question.
George, this isn't just from China, it's global, isn't it?
Yeah, because even now, how can you say the virus originated from China? We don't know. Maybe somewhere, because from very beginning we think there might be somewhere, either animal host, whatsoever. By the end, we couldn't find anything, because we will be working together with WHO for the origin of this virus, to work together for the origination of this virus, and working together in China, in the world. Let's wait and see. So these are scientific questions. What I want to remind you here, Dennis and my colleagues here, I want to remind you what China has done. You ask me. So in China, really, because we had succeeded in the first big wave in Wuhan, and then we have the virus got to the 0. We didn't have any more virus on April 8th. It's clean. So after that, now we already have 6 more waves. Let me count for you. So Wuhan is a big one. After that, northeastern provinces in Jilin and Heilongjiang provinces, there is imported cases because clean out in China. It's so clear, no more viruses there. And then we have imported cases to China. You know, northeastern provinces, Jilin and Heilongjiang, that's the second wave. And then Beijing, everybody knows, Xinfadi seafood market, that's the third one. And then the fourth one is Urumqi in Xinjiang Autonomous Region. Then you have next one is in Dalian. After Dalian, you have one in Qingdao. So all those clean up. So because you always have the peak and valley, peak and valley. This is what I'm saying, it's a wave. Now we are experiencing another one in Xinjiang Autonomous Region, in Kashi region there. So we are working very hard to trace back, because for those, we know the indicator patient, we know the sequencing of the virus, and then we can distinguish those virus one by one. They are different. They are not a mixture of the virus like what you would say in Europe and America, because
yes.
you had a wave, first wave, the first wave up, they are getting down and never get to the valley, and then you come back. So you didn't have a wave, you really have a tsunami. Once you have a tsunami, you cannot see the valley, you only have the peak. You do the sequence and sequencing, the sequencing data tells you, well, the virus mixed together. You cannot trace back for the indicator patient or patient 0. So as you said, because China, we are doing well. Why and how? Digital. This is our major point we want to make, digital. Because like you said, this is all mobile health. Because we have all this mobile health, we have this health certificate in your mobile. So we checked with everybody to see, where you traveled, where have you been? So this is very important. This is everybody think, you might have something to say about privacy, but once you have this digital, while you are talking about digital, or you also mentioned, I think Florence or Joanne mentioned about the mobile health. Once you have this mobile health here, it's important for you to get this pandemic under control. So anyway, you asked me for a very brief. I give you a very brief introduction. I'll come back.
Oh no, I come back to you, George. I come back to you.
Okay, thank you.
I should segue, because our mutual friend Galden Gallia, who is the head of the WHO China office, he commissioned a very smart lady from private sector to do a survey on the digital interventions in China. Now, the difference between China and the rest of the world is that you don't have these privacy issues, because the government, let me be frank, George, the government can mandate Tencent and Alibaba and Huawei to actually go do the applications and then deliver them. And my personal experience in China in the last year, I cannot go into 7-Eleven without having my temperature taken. I cannot go into a shop without having WeChat so that they know whether I am positive or negative. This is cool.
Yeah, Dennis, don't you believe this is very good for you? Because I think maybe at the moment.
I believe it's essential. I just, that's why I'm going to segue now to Bernardo, because Bernardo, unless we can have some transformational aspect on contact tracking and tracing, we will not move to the end of this pandemic. Am I right or am I wrong?
Thank you, Dennis. I mean, I guess we segue from introductions to discussing the topic. So
yeah, I think we're already discussing the topic. Sorry,
so,
sorry.
Apologies for my other fellow panelists that only did introductions. So I guess we'll get the topics to you as well. I work for WHO and I'm Director of Digital Health and Innovation Department and a CIO at World Health Organization. And as we go through this pandemic, first things we are learning as we move, and then we have the obligation to learn fast, and then to implement fast solutions, and to really bring together digital and health. Remember, digital and health, it's key, because if it's digital only and is not bringing the health benefits, so it's not connected to the public health response, then we do not actually get the value of the digital health to deliver that impact. I think Bernd said very well in his intervention. Of course, we're coming from a world that health systems are fragmented and siloed. We're coming from a perspective of lack of interoperability. We're coming from a perspective of uncoordinated work in even on the health sector, but let alone the different capacities between developed and developing countries in terms of health workforce. And also we have other challenges such as universal access or inclusive universal access to healthcare, basic health services, but also inclusivity and digital ecosystems. So we're coming from that perspective, and as we respond to the pandemic, we need to be cognizant that we have to not leave anyone behind, meaning that the pandemic is teaching us that a problem solved in one country in a pandemic, it's not a problem solved. So it doesn't matter how one country does well. If the rest of the world is not doing well, that's not sufficient.
The fragmentation of national responses has been shameful, has it not?
So it is an area that we need to do better. And then from WHO perspective, as a normative agency, looking at the evidence-based norms and standards, and also using our convening power, we believe that we can play a role to help the whole ecosystem to really bring the value of one country to help the others, or the knowledge of one country to help the others. And that's what we're there for. And we hope that we continue to play that role. But we need the collaboration both within the health professionals, within the tech professionals, within the politicians, within the professional in the socioeconomic area, because the impact is wide. So that's that from our perspective, and one of the panelists mentioned the national digital health strategies. Our member states mandated us to develop the global strategy on digital health. And while we have the experience of e-health strategy that many countries developed, that became just a piece of paper without implementation, we hope and we want this time to make sure that there is an implementation roadmap, there is an investment to actually deliver those health benefits and health gains that we want to get.
Absolutely. So how are you know, and I know that without big tech and without big pharma, this is just not going to work. So, and I'm going to go back to Bernd, and how will you engage the private sector? And how should the private sector be engaged with the WHO?
So, I mean, maybe just to pick on what was just discussed. I mean, and I mainly can contribute the European, but very international experience, and we are super impressed, basically how China basically managed to contain the individual outbreaks and manage it and really eliminate it at this point in time as it comes. At the same time, we're seeing many countries in the world, actually most countries in the world, that have not managed it that way, that kind of are in a state of managing almost like in a way chronic situation of a wave and declining infection rates and so forth. And this is now basically where also we come in, where the aspect of engaging in pooling together data in digital infrastructures, and that at least in Europe and internationally must be across countries, one country itself. I mean, needs its own infrastructure, but then broader networks that can be engaged. And this is now the answer to your question of the private sector. I mean, what can we, as health tech company, support? And first, we are super impressed, and in all the crises, there's a couple of positives that hopefully we can also.
I believe Bernd, I believe WHO is one of the great positives of this crisis.
Absolutely. I mean, it is that policymakers, governments, or World Health Organizations, the World Health Organization, healthcare providers, as well as medical technology industry has come together to find common solutions. The key to this is that we have common access and joint access to data to develop solutions to really help in a pandemic, but also beyond the pandemic in data-driven medicine. And this is where basically now aspects of experience sharing, of data-driven algorithms, of quick developments of test strategies or test technologies, of vaccines come into play. And this is where to work on a joint data repository is key. And yes, in a partnership with the WHO to guide and to also engage the private sector in terms of technology developments and then deployment of these technologies across the world in developed countries as well as in developing countries that have very different situations in responding to this pandemic.
Florence, you were at Alcatel-Lucent. You've had a lot of experience working on the Broadband Commission for digital development when I started it, and now I think it's called the Broadband Commission for Sustainable Development now, or whatever. But public-private is still very complicated.
Yes, it is. Although I think we need to pay attention to this paradigm, hopefully changing with the times. I, built partnerships over 30 years ago in my career, and the atmosphere was very, very different back in the late 70s, early 80s. I think the last 30 years, has seen us sort of go very, very deep into what we coin as financial capitalism. And there's been, unfortunately, an increased sort of suspicion between, I think, public and private over that time. I grabbed onto, very hopefully, back in 2011, the beginnings of a trend that was looking into sort of countering that, namely, some of you may have heard of the shared value article published by Michael Porter in the Harvard Business Review back in 2010, 2011, I think it was. And this trend has increased, and luckily, the COVID crisis, I think, has accelerated this quite a bit. So it's the private sector, and including all of the, I would say, mechanisms that control it, down to the accounting systems that are currently being rediscussed on sort of impact, not being measured only in terms of financial returns, but as well on social impact. So I don't want to go too far into this because we're supposed to talk about digital health, but I think since you're asking about
we were speaking the other day about the acceleration of telehealth in France. Remember? Yeah. And you say it's almost exponential. Yeah.
Yeah, I think in general, the crisis has, in respect to digital health, whether it's in telemedicine, I mean, there's unbelievable examples. I mean, some people claim there was more progress in 2 months than many of us have seen in 10 years. Not on every single aspect, but in a decade. So telemedicine was definitely one of them. To give a couple of examples, there are many. In France, we indeed went the first week in March to 10,000 consultations per week to 1 million 3 weeks later. So quite stupendous. I think Ping Han Good Doctor in China registered plus 900% just in the month of January. And there's examples like this in many countries. Interestingly, though, telemedicine, which is a subject that we may not have time to go into now, but I think there's a lot to be done in terms of cross-fertilization here, because lo and behold, to my great surprise, when I was asked to kind of do a global scan on what happened, it's really not that many countries who were able to leverage during COVID, because you had to have a certain level of maturity. Highly dependent telemedicine on regulation. I think there's a big, I turn to Bernardo here. There's something really big to be done here in terms of spreading the word best practices, because I didn't realize how behind the world was in telemedicine, which is a really basic element of digital health. It's one of the foundational, one of the first ones. People have been working on this forever. It's not as complex as some of the other, Bernd, you mentioned AI and data, that, there's a lot of different components there. Telemedicine is a low-hanging fruit as far as I'm concerned, if we do the right things here to kind of spread the word and bring the tools together for countries to be able to grab onto at least this, but as generally speaking, the impact of COVID, I just want to name a couple of other examples. It's just been stupendous. Telemedicine is definitely one of them, but it's accelerated definitely the AI and data space, although I think we have to be a little careful. AI and data is a very big hype thing. If you talk to people on the ground on what's actually happening, I was speaking to the lead person here in France who's driving the national digital health strategy and who's actually a specialist of all this. He's a true engineer and studied, AI and data some 25 years ago already. And he says, look, I can give you on the one hand, what, the true, deep learning things that are happening in France. And France is actually pretty advanced in all of this. So I think we have to be realistic also. I think the subject today really has to do with, and many of you have already named the infamous, interoperability word, and AI and data is not going to happen until those foundations are laid out in terms of interoperability. I think it's fundamental. This word gets thrown around. Now, I'm not sure everyone completely understands, because it's a pretty technical aspect of things, what that actually encompasses and means within an actual national digital health strategy, what it means in terms of architecture. I know, Joanne, you're a good expert on that. Maybe you'll be able to.
I'm going to come back. I'm going to come back to Bernd on AI, because obviously that's absolutely fundamental to the future Siemens strategy. But Joanne, my view in the COVID crisis is that mobile is actually fundamental. And I'll come back to you, George, after this. And then Bernardo, if you could, build on this in terms of where you think the fundamental focus should be in terms of accelerating progress, not just on emergency, but through digital transformation and through network of networks. But Joanne, mobile, why haven't the mobile operators understood digital health?
That's a great question, Dennis. I think they do understand digital health to a certain extent. There's been quite a bit of investment and exploration on digital health for many years, with mixed success. And in some cases, I think their timing was a bit off. Like what we're experiencing now was the acceleration of digital health as a result of the pandemic. And that's wonderful, but that's a timeliness factor. And many of the operators have invested heavily in digital health and have probably been too early, right? We saw what around the 2010s.
Yeah, but clearly the incentive structures have not been built in by government. Okay, so government has not actually incentivized investment in digital health by the mobile operators. On the other hand, and we have to say this, the OTT operators, the top operators, which is Facebook, which is Google, they pay nothing for infrastructure, and they're riding on the top of this, and they're paying nothing for it. Yeah. So at some point, you've got to be incentivized.
Yeah, there is that layer in between, right? And I hear an awful lot of people talking about the investment in digital infrastructure, but I'm not really sure that people really understand what that means. I've even heard people talk about the analogy of roads, and roads is a great analogy if you're thinking about, yes, we need to invest in actual digital infrastructure, but really what I would like to advocate is that the investment in digital infrastructure, it really is about investment in architectural principles, in open systems, open APIs, standards, consistency, and all of that. And you need to do it in a way.
Where does WHO and ITO fit in there? ITU, sorry.
They can fit directly in there. So ITU by way of endorsement, development and endorsement, WHO by way of recommendation. The governments do listen to WHO. There needs to obviously be a degree of decision making with regards to what gets decided at the global level, what gets decided at the national level, and what gets decided, you know, at an application level. But, you know, there is obviously a role for all of these to play, and there is that investment in digital. I would be concerned that we would invest in a way that we have invested in the past. And what COVID does is create a new opportunity to think differently about how we invest in infrastructure. And that's what's important. You can throw a huge amount of money at this, and if we do it in the way that we've done all previous digital infrastructures, we will not get enough return on investment, and we will not drive down the cost of R&D in a way that allows us to get the reusability.
Can you say that again? Drive down the cost of R&D. Can you emphasize that?
You have to drive down the cost of
of
R&D.
R&D.
You cannot
And that's for LMICs, yes?
That's across the board, Dennis. That's, you know, you need to understand what's standard and common, and create it once and let everybody use it, and understand where the boundaries of differentiation lie. And by doing that, by understanding that and driving down the cost of innovation and reuse through all the common aspects, that's how we can get to achieve SDG 3. There's, you know, it's not possible otherwise. It's the cost of integration, the cost of building hard-coded pathways of integration is unsustainable, inscalable, non-flexible, and will not allow us to get to where we need to go.
George, China's leadership role now in the developing countries, seeing as we have seen an abject absence of leadership from certain countries who I will not name, but we probably both know who I'm talking about. Where is China in terms of global leadership in moving forward?
I think, Dennis, this is a very good question. As a,
Sorry,
you know,
it's a little political. I'm sorry, but I had to ask. You know.
Well, you have to keep yourself open-minded. You know, you can ask whatever question you like, but and since you lived in Beijing, as you said already, you've been here already one year, right? You are in Beijing. You think
no, I've been here before. I've been here before a few times.
But you lived this time for 1 year already.
1 year I have been in Beijing because I couldn't leave because there was nowhere to go.
Maybe because this is the safest region at the moment in the whole world. You want to save your life? You want to save your life? You stay here.
We had some spikes though, George. Remember June? We had some spikes.
Anyway, I think, I don't think, it's a good idea to say, as a developing country, China want to lead something. I think China, what we are doing our own development at the moment. For the control of the COVID-19, UN said something, COVID-19 provided us with something new to rethink, what we should do. For the public health and the emergency response, looks like at the moment, as you said, that we are doing well. We have been doing well. We are still doing well. So I don't think, any other country can copy us, but at least you can learn a lesson, learn experience from what we have done and what we are doing. I mean, for that, for the COVID-19, so we want to tell everybody, active case finding for the indicator patient or patient 0, very swift finding. It's a very, very important part. So
I suppose specifically, George, I'm asking how are you going to help Africa and how are you going to help the rest of Asia in terms of
as you know, we are the donated many diagnostic kits from private sectors and from some government agencies, including China CDC, to Africa. And also, Africa CDC, the main building will be built by China. The Chinese government will donate a building for Africa CDC. At the moment, my organization, China CDC, we are training a lot of African friends and CDC staff for the, including the information system, the digital part, and also for the lab part, the wet lab work. So I think, we are doing for the building, for the techniques, and also for the information system. So this is what we are doing. I still have some colleagues, they are still working, for example, in Sierra Leone. For this, they played a very important role. They are still playing a very important role for the COVID-19 control in Sierra Leone, because we have a lab there. We have our BSL-3 lab actually in Sierra Leone. So this is a very good example. I think.
Yeah, George, China, I have to tell the audience the day we met in, I think it was in December last year. You just had come back from Africa, and you just survived a plane crash.
I am not supposed to tell this private stuff there, but actually, yes, you are right. You're yes. Right. I was in that particular plane, but
which crash?
I mean, yeah, but it doesn't matter where you are. But more importantly, so that if you want to measure this, that's our commitment. Even the DG of China CDC. We went to the most dangerous of not really, let's say, Dennis, not really safe, but you got to be there. So that's our, that's the help or the work. We would like to collaborate with our African friends, our colleagues from our heart. I don't want to mention it, but you mentioned this. Okay, that's good. So yes, I was in that particular plane.
Well, thank God you're alive. That's a great thing. And,
yeah, because I have to be here to fight against COVID-19. If I were, not survive that case, I don't think I'm here to discuss with you about digital health and also play a role for the COVID-19 control. Thank you, Dennis.
It's all right. It's okay. Bernardo, Africa. Now, Bernardo, I know you're from Mozambique, which is, I love Maputo. I love Mozambique. I've been many times and worked there when I was at the United Nations. But can you describe to us, are we on the verge of a second wave in Africa? And how is WHO going to respond to that? And then perhaps Bernd, you could come in after that and tell us what Siemens is doing on a global basis. Bernardo.
Thank you, Dennis. I think, I mean, to do justice also to the topic, in addition to the response to the pandemic support that that Dr. Tedros launched, the ACT accelerator, right? The access to COVID-19 tools accelerator, to really ensure that, to make sure that the whole world is able to address all the challenges, both on diagnostics, on therapeutics, and all the other areas.
Vaccines.
Exactly. So that is one initiative that is I mean, not just WHO, but the number of partners are together trying to make sure that that we get to the bottom of managing this pandemic in a way that we get back to that new normal, which might not be similar to the previous one, but at least we'll come back to a normal situation. So that's one. So there's a whole response that is taking place as we speak. But as we speak, we're also trying to take lessons to learn to make sure that the next time around we are much better prepared. So there's this preparedness work that's going on as we speak with a number of partners. We're putting a roadmap to look at how we can develop maturity on the systems that we have to. I mean, I always say that compare this preparedness, especially early warning, with the weather forecast. I mean, weather forecast developed quite substantially in such a way that today we can have a very good predictive modeling of weather.
Climate change has kind of developed as well, you know.
So we need something on disease early warning systems that will also create some modeling. So it's this is part of the work that the number of stakeholders, ourselves as well, we are doing.
Specific question, Bernardo. How is digital health, your unit, digital health and innovation, which is a new unit created after the great World Health Assembly Declaration, how are you liaising with emergency, with Mike Ryan? How are you liaising with data? Because a lot of people wonder how WHO is working together.
Indeed, WHO, be it with emergency, be it with one of the diseases, there is an underlining sets of services which is delivered by the science division, where digital health innovation sits in. So there's a cross-cutting nature of the work of the department I lead. But also there's a cross-cutting nature of what data it needs to do to make sure that we do not just look at continue to evolve in a siloed way that I mentioned before, but we breach those silos. Just to give you an example, we are working with our immunization team to create a digital international certificate of vaccination. So we have the use case of yellow vaccination card. I mean, we have today, even when you talk about resuming economic activities once the vaccine is there, if a country is requiring somebody to actually show that he or she was vaccinated, so which card are you going to use? We don't have a legislation, an international health regulation that really allowed us to do that. So we are working with a number of member states on that. But also we just launched recently, and Florence, you mentioned investment. We launched a digital implementation investment guide to make sure that countries that need to invest in digital health, they do it understanding all the areas that they need to do. But also we are working to bring together a dynamic digital maturity model, because there's no point to invest in the wrong area when your maturity model, it requires you to invest in a different area. So those are the tools and capabilities that we want to make sure that countries have. But let me reinforce the area of surveillance and early warning, which is important to prepare now, because better preparedness doesn't happen during the pandemic. It happens before the pandemic.
Precisely. Yes. And as you know, I worked with the Commonwealth nations on a mobile action on pandemics, on Zika and Ebola, and we're restarting that program and hope to work with WHO in the future on mobile action on pandemics, which would include all of the mobile operators who would share their data sets. And obviously pharmaceutical, are they also the guys that actually have the real data, George? As you know, I mean, they're the guys with all the data in terms of vaccines and all the rest of it. But Bernd, on the data question, why should data be shared with the private sector?
Let me there comment, and I think you mentioned it earlier, on why would AI play a role.
Yes, if you could actually give us a perspective on where you believe AI is now and where it will be in 1 to 2 years, not just in terms of the pandemic, but in terms of industry evolution.
Yeah, no, and Florence, I think it was you mentioning this, that the word of AI is tossed around quite a bit, but it can be actually very precise if, I mean, you try to frame it, where does it contribute and what it needs to be developed. I mean, AI from a technology perspective, I mean, can be applied in various levels. I mean, it can make complicated machines more intelligent so that they are easier to use. It can help medical professionals making diagnostic decisions aided by experience embedded in AI algorithms that was developed over many cases that were used to train the algorithms. And it can even go beyond to make their...
Are you working with WHO on this stuff?
We are working and advising and discussing. What the private sector requires, and that was also your question, is, I mean, access to data from use cases that can be then reapplied. and I'll get to where we work with WHO are interested in reaching out also, because I mean AI algorithms are only as smart as the data on which they are trained. That's why they're called artificial intelligence. And this is where we actually, the private sector has the challenge with that we need data in a context of also local populations. So
can you say that again? That was really good. Artificial is only as smart as
the data that it's being trained with.
Brilliant, brilliant.
So
yeah, because that is true, I think. Yes.
And
yes.
that's why we're currently technology companies are a bit struggling with basically access to data in some parts of the world, but in some not. And AI algorithms, I mean, need to be trained on data in a local context, in local phenotype, in certain phenotypes that respond or that have certain therapeutic directions, and also in local healthcare systems. So that's why I give you the example of our own case, that we actually tend to train today our algorithms on data we have from the US, but want to apply them to Europe, to Asia, and to Africa. And we're not so sure whether this is a great idea. That's why this local collaboration of having access to data in the context of local healthcare systems is we consider very, very important. And where we believe also collaboration with WHO is very helpful is AI can on the one hand aid obviously medical professionals to make more precise decisions. On the other hand, it can also help to compensate for shortness of training or even availability of medical professionals, where probably AI can read data and can make at least suggestions for diagnostic decisions where there is no physician on site, so that AI combined with telemedical solutions can help in remote areas of the world to bring super precise decision making into an area where the population needs it. And this is where I believe the collaboration of having availability to data under very strict and very conscious guidelines of access to this data and data privacy regulations, but to do this as a global undertaking, we think is very important. And COVID has shown us that this can happen very, very fast if we are forced to.
Where do you think data governance regulation should sit?
I mean, first, a general answer, on the right level. And we are, I mean, and as a company and European based, to have basically European regulations. So
I ask you because you're obviously a German company, okay? Yes. And you know, the level of privacy in Germany, the level of privacy protection and data privacy in Germany has always been an issue.
Yeah, and it still is. And I think the overall governance of these data regulations we actually find very prudent. Its implementation at times tends to be subject to local interpretation, where the risk of data privacy challenges and the opportunity of what value you can provide with it to the patient tends at some point to be misbalanced. And there, the pandemic has shown us that we might learn from it under crisis. And I give you, there was a simple example that in lightning speed, I mean, in a very few months, companies were able, including us, to develop algorithms that were able, AI-based, to detect COVID-19 diseases. Before PCR tests were actually around, it was shown actually from China, first Chinese data, that CT scans were able to detect, to differentiate COVID-19 related pneumonia or lung disease compared to other infection causes. And if you take this as an example and take it to a broader context, where this virus shows us that super complex diseases, where we don't understand yet all the impacts, who infects whom, who takes a severe outcome of the virus. There is where AI in combination of large data really
I know
helps.
Bernd, I know this sounds like a dumb question, but considering, you know, the sophistication of AI, the sophistication of everything that we have technology-wise now, why have we not got a handle on COVID right now? We still don't know what it is, do we?
I mean, I'm a technology person, but I can raise an opinion. I mean, because it is, I think, very complex. And I will take an example to a non-COVID related subject. I mean, this disease with all its variances and impacts, I mean, calls for something like large experience pooling of data to understand its impact. And we are not there yet. And
it's a beautiful segue, because we're going to go to global collaboration, because we've got half an hour left.
Yes.
And that's marvelous, because I've got to go back to Bernardo very quickly. Bernardo, the ACT Accelerator, which you mentioned, which is a marvelous collaboration, and obviously the Gates Foundation, the Wellcome Trust, should be congratulated on, you know, their contribution to this, and also CEPI and all the rest. But we have the vaccine pillar, we have the therapeutic pillar, and we have the diagnostic pillar. But at the base, the World Bank is supposed to be leading the health systems integrator pillar. Where does WHO fit into that?
I mean, basically, we are all pillars, right? So collaboration with all the stakeholders. Some of them that you mentioned, others that you didn't, but we are basically, because this is the collaborative
I can mention them: Find, Global Fund, Wellcome Trust.
Yes, exactly. So all the others. So there's always a risk by if you mention some, you miss some others, and
sorry.
So that's but all to say that we are collaborating with all of them, and we're basically looking at what value we bring, because the key to the success is to make sure that each entity brings its best to the table, because then the collective power of the best will deliver the best results. So there's no point of one entity to say, look, I want to be in the table when you're not best at that. So at WHO,
Bernardo, this is new thinking. People haven't thought about this for a long time. I
think the COVID is showing us that we need to think differently. We need to reimagine how we collaborate. Because if we continue to do the same thing as before, we will face the same problems as we're facing today. So I think it requires that change. And at WHO, under the leadership of Dr. Tedros, that change is there, and he's willing to push the boundary and making sure that we embrace the change, but also we challenge ourselves and we learn from it. If we're not doing well, we learn from it and we do better next time. So from our perspective, I mean, one is we're building this network of networks together with ITU and a few other partners, that to make sure that the conversations, such as the one today, it doesn't happen with the people that normally are sitting in those conversations, but it happens across sectors. I was very delighted yesterday when somebody spoke from the perspective of community health workers, the volunteers at the community level, to say, don't forget them. So because we tend to create systems and then we work in one country, but then other countries need to ensure that the local context, I think one of the panelists mentioned, it's key, even for AI. If you have AI model that is tested in one continent, and then you apply it in Africa, for instance, of course, we might have not such good results. And therefore, I think that collaboration is key. Now, in the global strategy on digital health, there are a couple of elements on data to make sure that we support the development of AI. So one of them is benchmark of AI. So it's part of the global strategy on digital health. But the other one, which is very important, is a regulatory framework on health data or international health data. That's a very critical piece, but also very challenging, because many countries they're very sensitive on data for primary use, for secondary use, but we have to navigate that to ensure that we reap all the benefits of AI, technologies such as AI, but also to address challenges like Florence mentioned of technologies that are already matured, such as telemedicine. We should not be where we are today on telemedicine. We should be way ahead, because telemedicine is mature enough to be used, but policies and policies of countries, even at national level, are making it difficult. I know countries one country, from one state to the other, you can a medical profession cannot practice telemedicine. So we have to use the lessons from the pandemic to really address some of the critical challenges that we're having, or blockers that are not allowing us to fully reap the benefits of digital technologies.
Absolutely. Okay, George, and then I'm going to come to Joanne and Florence. I want to move to investment now, because there's been an extraordinary push through the ACT collaboration. I mean, we're talking 30, 40, $50 billion. But digital health is peanuts compared to this at the moment. But without digital health transformation, we will not have the supply chain or the delivery mechanisms that will actually move us to the next level. Where is China on digital health?
Dennis, because I'm working in the China CDC. I'm not.
I know you're a virologist, but you're also an intellectual. So I'm asking you from a.
Yeah, let me give you a comment. I think for the digital health, the most important thing is data sharing. I do agree with Bernardo. Even in some countries, even the state, or even, for example, the provinces, if they can't share the data, how can you use the, digital? How can you have the digital size? The data sharing will be the base for the digital health. So at the moment in China, I think that we are doing well. We have a very centralized data collection system. For example, in my China CDC, we have all this data shared for the different provinces and, under the wing of China CDC.
How are you sharing? How is China CDC sharing its data with America's CDC?
Yeah, I think, we have very close collaborations there. So we always share all our data. For example, the virus and the virus information, you have H7N9, even the COVID-19. I think we are doing well. For all this, when you think about the digital science, digital part, I do agree with Bernardo. And you also need to change our attitude after this COVID-19. So we need to think even very, very hard.
So you believe, George, we're at a mindset change with COVID-19?
I believe so. So I do believe, when you think hard, we are in a very kind of a position. Everybody is thinking, what's your technical organization should play, what's the political will you should do, and what's the public should try to understand the public involvement. When you are talking about public health, it's not just a politician or politics, not just of the public, not just the scientists or public health workers or staff. It's it's a quite complicated or comprehensive issue. So this is why I think after COVID-19, we got to think very hard. I would suggest, Dennis, if you have energy, we should organize something about rethinking digital health after COVID-19, focusing on how we should organize for the globalization and for whatsoever about the AI and digital health. Otherwise, so I think definitely COVID-19 provides a very good chance. Thank you.
I think that's Bernardo's shop, really.
Yeah, I do agree with Bernardo,
Yeah, no, Bernardo is rethinking, and he's doing a fantastic job. Joanne, on investment, what are your thoughts? And perhaps on data governance, and then Florence, and perhaps Bernd, do you want to come in? Bernd, there has to be, I think, a paradigm shift, and I hate that term, but sometimes you need to use it, on investment in digital moving forward.
So on
Joanne?
investment, I think there's a number of aspects to it. I think one is that we need to think differently about the digital infrastructure layer. First of all, essentially telecommunications or connectivity is the basis upon which you have digital health. And if there is a large sway of the population with no access to connectivity, that's your first thing that you have to solve, because you're not going anywhere without connectivity in the context of digital health.
There was a point, Joanne, there was a point we were discussing before, which actually is important in terms of COVID, that digital is probably the only way that you can actually comprehend the ubiquity of the pandemic, because digital is by its nature ubiquitous.
Yeah.
And that relates to investment, doesn't it?
Well, digital is ubiquitous, but not all digital is the same. I mean, it requires a huge amount of investment in consistency and data models and architectures and various things in order to get to that point. My big point for investment would be to make sure that we are investing to think genuinely right out to the future. Like a good architecture will stand you at least 10 years in time. So you need to be thinking about the things that you cannot yet even imagine. And so therefore you have to invest in what is flexible for the future. I'd be very concerned if we were investing for something that was rigid in any way. So it's investing for flexibility and to cater for potentially new future business models, which allow us to move into an environment where risk and reward is shared between the suppliers and the service provider of healthcare. I think that's a very important thing that will drive down the original capital investment and move into a model where it's a flatter model. So I think ecosystem platform designs, shared risk reward, bringing together public-private partnerships, but being able to do it in a way that drives reuse and consistency. We heard about the notion of global versus local. If you can design in and understand what is common, what is extendable, where localized differences can be applied, but applied in a way that still manages to get the most from the global designs or the common patterns that are used globally. That, I believe, is the way to get the cost of R&D down, but also in a way that is fundamentally scalable and make use of sharing knowledge and things like that. But it is this combination. It's very hard to do. It does require a lot of stakeholders to work together. But I do believe that the document that Bernardo mentioned as the investment strategy that was laid out recently is fantastic. Is exactly the right
the big dig. Yeah.
Yeah, it is good.
No, the DIIG. That's the big dig. Yeah. I think it was an excellent document, and fair play to Garrett and the team for putting that together. Florence, and then Bernd.
Yeah, I just to rebound on what Joanne said, I'm going to give a very concrete example because there's nothing such as those to speak to exemplify a little bit what you were just saying, Joanne. But there was an initiative in France during COVID called SIDAP, and it's one of these amazing acceleration things that happen during COVID, whereby they said, okay, we want all of the test results from COVID cases to go back to the central database. We have actually a very interesting, and I'll go back to that afterwards on the health data governance, something called the Health Data Hub in France. And we're right in the middle of all the implementation kind of dilemmas around that. But anyway, so SIDAP, they, within a month, basically decided, we're going to centralize all that data and somehow built in the interoperability layers, right away that were needed for that. And they made it happen, but it cost $10 million to do so. And talk about a wasted investment, right? I mean, you were just talking about wasting resources. If you don't have that infrastructure in place, then that's what happens, right? Hence, I think your argument with Joanne, I completely am aligned with you. And then perhaps I'll explain it a little bit with different words in different ways, because it's not always easy to understand all of the different pieces of the puzzle that go together. ITU and WHO back in 2012 built a guide, the guidelines to build what you call a national digital health strategy. And that has 7 different components, okay? Infrastructure, data, interoperability, those are like 2 or 3 of them, but there's a lot of other stuff that needs to come together. It's complex, it takes time, and it takes a lot of money. There's the skills component, obviously the regulation component. It takes a lot of cross-sectorial work, that we showed in our Broadband Commission report back from 2017, that the countries who made it happen and where it worked is when the Ministry of Health worked completely hand in hand with the Ministry of Telecom, because it takes the expertise from both fields to make it happen. Again, that an example, data privacy, for example, patient rights is going to be a little bit more of a health, sort of matter. But if you talk about data privacy, security, then it's going to be a little bit more the IT. So when you're building regulation around digital health, you need the expertise from both of these regulatory bodies, which are separate right now in government. So that in itself is a challenge. But to answer the investment, which is, I think, a very important question, because I think it's wonderful.
How much do we need,
WHO.
Florence, to kickstart this revolution properly? How much do we need?
Yeah, I think it's hard to, I don't claim to be an absolute expert on this. I'm going to give you some numbers though. I used to quote the fact that Rwanda, the first 3 years, and this is, many years ago, invested $35 million, in the first 3 years. The World Bank had invested in Gabon a few years ago, $50 million, but I think that's just the beginning. France just enacted a budget for the National Digital Health Strategy this summer of 2 billion euros, okay? India just enacted theirs, and they're saying that I saw their budget of 50 million, but they're saying that's just to do the POC. So again, you've got to think about that investment. No, it's not, you don't make this happen in 2 years. It's a long-term commitment to make all of this work in the end in a sustainable manner. But you've got to invest in these foundations, otherwise you're going to keep wasting money and we're going to keep fragmenting and being, sort of all black and white, just to make my point. Of course, it's not quite as simple as that. But I think there's a big gap currently. I think there's a maturity coming together. We see, Bernardo, you mentioned more and more digital strategies coming together from countries. We see even in Africa in the last 2 years, there's been more, but this is paper. Then we need to implement, and that remains, sort of still the big challenge, because that requires money. And I think the biggest gap is still also governance. So donors need to come together. They did sign digital health investment principle back in 2018. If you look that up, you will see that many of the development banks, not all, have signed on to that. But that's just, putting a logo and saying yes. But are there any digital, health experts within these banks? In some, but not all. And that,
there is a deficit of
then,
Florence, the deficit of experts is quite severe in this area. No?
Dennis, for some reason, I've lost the connectivity a little bit, so I'm gonna have to.
The deficit of digital health experts is quite severe. You've just disappeared. Florence, you're under the table. Hang on. You okay? Are you back? Bernd, I'm going to move to you, Bernd. Florence, you back? Florence is offline. Bernd?
No, so, yeah, maybe quickly.
Yeah,
I mean,
Bernd, where is Siemens going to play in digital health moving forward?
Let me maybe first you asked the topic of where investment, and I would say there
right.
to build the basis. I mean, and it's as simple as difficult that we would love to see national electronic health records to come across multiple countries, the EU and beyond, that then can be interconnected to then serve as a common data repository in the benefit of patients and in the benefit of preparedness for any future pandemic situation, but also for retrieving intelligence for potential development of decision support systems that help with super complicated diseases like cancer and others. And this is
right.
when the industry comes in to help work with this data in the developing technologies. But it also requires, there's a private sector also in healthcare providing. And there, we see this not conflict, but this not solved equation of how is a private healthcare provider system also, quote unquote, and not a great word, but there's no better one, incentivized to also onboard
yes.
this. And this is basically where public and private sectors have to move together in terms of basically encouraging and also financing work on a common database. And the second one I would like to add is, and that's I can only fully underline what Bernardo said, in providing a legislation environment as well than the investment required in telehealth infrastructures. And the country, Germany is also such country. Even in the US is another example where telemedicine by legislation is not really endorsed. And this is something we have to overcome through this pandemic, because to provide virtual healthcare is as much as it is possible, is cost efficient, is increasing safety and security by distance, and is even reducing CO2 footprint if you don't have to travel in a car to see a doctor for 5 minutes.
Excellent, excellent. Yes, and we can't actually, you know, there are many issues we haven't. I'm glad you brought up electronic health records, and we haven't even talked about blockchain, for example, which is probably a game changer as artificial intelligence in terms of moving forward in the health sector. But we also need to realize that climate change is absolutely fundamental to the future of healthcare in terms of not just carbon footprints, but respiratory illnesses and the diseases of climate change. We're seeing a convergence. I think what has actually happened with COVID is this convergence between a massive infectious pandemic with chronic non-communicable disease. And previously, when I was speaking to Bernardo about this, I think just last year, Bernardo, I was saying that the only way that we're going to move forward on digital health is to incentivize the monetization of healthcare to try and solve the burden of disease in chronic NCDs, which is obviously moving health systems, George, also in China, yeah, towards financial ruin. But now we have both, and it's happening at the same time. So we're going to see this massive acceleration in digital health moving forward. And I'd like to thank Julian Kickbush for giving us this platform. And also yesterday, the session with Dr. Tedros, which Bernardo and Sumia and Suda architected, is really moving the ball forward. We have 12 minutes left. I want to give you, each of you, 2 to 3 minutes maximum for closing arguments. George, closing argument, please. From Beijing, from around the corner where I am.
I would like to say, to answer your question from the very beginning, how China would collaborate with Africa. So digital health definitely will help us to realize the United Nations 17 SDG, especially to solve the problem for the equity and equality, because digital health and AI will help some poor countries, less developed countries to access to the modern or advanced diagnosis technologies and treatment technologies. So that's very important for the United Nations digital, United Nations 17 SDG goal. Thank you. That's my final comments. And China, definitely we will accelerate our digital health and AI use for.
George, you still have another minute.
Okay, another means I'm calling Dennis. So, you know, we should try to work together. You ask me about, you know, what happened in China. So at the moment, you know, for the digital health, I think we have to, I should say, we still have to accelerate the digital health to reach even for some areas, you know, as you know, China is imbalanced in terms of development. In some areas, you know, it's very really need some help for the good or advanced technologies. Not just I'm saying about the, you know, working together with Africa. So we should try to use the digital health to solve this problem, to realize the universal health coverage. Thank you.
Oh, I'm really glad you brought up universal health coverage, because it's quite clear that the COVID crisis economically has put in danger not just SDG 3, all of the Sustainable Development Goals and the achievement of universal health coverage moving forward. Joanne.
Thanks, Dennis. So my view would be that we're really at a pivotal point in history with regards to the momentum and focus on digital health as a result of the COVID pandemic. We need to make sure that we use the energy, the goodwill, the momentum from the people, the mindset shift that this has caused, and the money, all of these things together, to invest it wisely so that we lay the foundations, the right foundations of digital health. So you wouldn't build a clinic or a hospital without architecture. Please don't build digital infrastructure and digital technologies without good architectural practices and principles. Let them guide you. Use the global common definitions and create it in a way where there's a lot of collaboration, so that there is a lot of common elements to the digital infrastructure of the future, and make it such that it's highly extensible, so that you have a common global set of tools that can be used and applied locally in a way that suits that local region. So build flexibility into your systems from the very beginning, using the right architectures. It is incredibly difficult to change infrastructure after the fact. And we know that. That's why we're living in a system that is fundamentally siloed and segregated and fragmented. In order to fix it, this is our opportunity to fix it, and it will lay the foundation for years. We will have advances in society for years ahead if we do the right things right now. So collaborate, don't reinvent the wheel. Look around you. Every time you think you need to start something new, don't stop. Look out, look around, see what exists already, reuse it, point to it, share it, accelerate it, give it a loudspeaker, and really just open your arms to community and working together across different sectors even. You know, the places of where ideas for solving this will come from, you know, out the corner of your eye. It may not come from the most obvious place that you think it will come. And therefore you need to lower the barriers for innovation, open your mind to the fact that the possibilities of where the answers will come from may not come from where you think they'll come from. So it's really an open mindset, which I believe we have right now, which the COVID pandemic has created, and we need to make sure we capitalize on that. So let's use the principles that are being created, drive down the cost of innovation, drive down the barriers to innovation, and then collaborate so that we can create flexible systems that are interoperable, that can create genuine patient-centered cares of the future, and that can be localized in different regions for the needs of different societies. And that's it. Oh yeah, with that, you need to also stimulate procurement. You need to think about how procurement, you must remember that every time you buy something, you are sending a message out to industry. If you are buying in a way that doesn't adhere to the global principles, then you are sending a message that doesn't matter. Make sure that you reinforce all of these principles in your behavior, in your procurement practices, and it's from that behavior that we will, you know, grow a momentum behind the principles.
Thanks, Joanne. And I'm talking to you in Kerry, am I not?
No, I'm in Cork in Ireland, yeah.
In Cork. I have to tell you guys, Cork is one of the most beautiful places on the planet. It's absolutely beautiful on the west coast of Ireland. Florence.
Yes, I'll keep it short because I think I want to re-emphasize what Joanne
We have
just
6
said
minutes.
to me.
Yeah, you've got 1 or 2 minutes.
There you go. So I think what she said is probably one of the biggest gaps that I observe after 10 years of being into this, is this coordinated investment and the investment in the right thing. And this is not easy. And this links back to governance. I want to encourage taking advantage of having Bernardo here on the panel, of seeing how WHO is maturing in their thinking of also this network of network. I've seen also the Fondation Botnar kind of supporting some of these more global potential initiatives. We need to keep pushing all of this because it needs to come together. One last thing, which was fascinating, I listened to an expert on this whole data security, and privacy issue, which is very delicate, and of course everyone is talking about it, and we're obsessed, right, with it, because it's a human right, and you know, all those things that have been said. She said she's a researcher in this. She's been doing studies. There has been so much said and for so many years on this stuff. She said the problem, you know, we've identified it. It's solved. It's time to move to action now. So I think, you know, this framework convention that was also discussed a couple of days ago on the governance of data is essential at this point. Everything has been said, so we just need some action at this point. Of course, I'll leave it to the institution to figure out. I know it's a delicate subject, you know, on how of a soft law or some sort of convention needs to happen, but it's all there. There's no need, she was saying, to continue having workshops, which people are offering. Now, I heard, oh, in 6 months, in a year, we're still going to discuss about all of this. It's all been said. So I think that's another thing that really intrigued me 2 days ago, and I think it's time for action now. We don't have a choice.
Yes, excellent. And in fact, Bernd Montag, who's Bernd, everyone's called Bernd at Siemens for some reason. Actually, Dennis O'Brien, who's a mobile guy, with Carlos Slim, who, as you know, he runs Telmex in Mexico. I met Dennis O'Brien when we launched the Broadband Commission with in 2010, and he said, "Dennis, is everyone in Ireland called Dennis?" So Bernd, over to you. But I know also Bernardo, you were on that panel, I think, on data governance, and I'm going to close with Bernardo, but Bernd.
Yeah. So I mean, my final thoughts would be that the
why are you called Bernd too? By the way.
Oh, well, I mean, it's not a prerequisite to work for Siemens Healthineers, so, but it helps. so I mean,
sorry,
current,
I couldn't resist. Yeah, okay.
This current pandemic, I think, has taught us and the world the hard way, in a way, that a resilient healthcare system is and a functioning healthcare system is mission critical to society and to global economy. I mean, this is one thing that was learned in a very intensive way, and that the WHO, the global healthcare leadership, is in the center of interest right now. I mean, is something that I think is deserved and absolutely required. If I come to the topic of now digital health and AI for pandemic preparedness, which is the title of our session here, I mean, we found that digital enablement and a digital basis and a foundation is mission critical for a resilient healthcare system. It is by means of quick exchanging of information what a rising pandemic is all about and how to best management to early respond. It is about to develop tests, infrastructures, and diagnostic procedures in order to very quickly help manage it. It's also to digitally manage capacities, which are critical when an inevitable wave is coming. And it's also to manage digitally international logistics, the national also trade, international supply chains, where when you speak to a technology company, global supply chains are something that will not go away and we will have to manage. And this in a world or in a situation where a pandemic has to be managed, but at the same time, all other chronic and critical diseases have also to be managed at the same time with the capacity available. And this is why I think a digital infrastructure, which is yet not everywhere mature and is something that needs to be learning from this pandemic, that this is key to invest in order to be prepared for hopefully not a next one, but if we need to be prepared.
That's very eloquent, Bernd. Thank you so much. And Bernardo, if you could wrap up, I'd just like to note that on November the 18th, you will be having the WHO virtual roundtable with academia. On December the 1st, you're planning the WHO virtual roundtable with the private sector, the first one that you have done. And as you move the agenda forward on the development of the global digital health community, I have to say, I've been in the UN system for a long time, 20 years. But Dr. Tedros, yourself, Sumia, Mike, Wow, you got a great team, and we're all behind you. And God bless the WHO.
Thank you, Daniel,
Bernardo,
and thank
if
you.
could wrap up.
And indeed, it is about working all together. And Dr. Tedros likes to repeat, solidarity is key. And then I think WHO will only succeed if countries, partners, all stakeholders support us, or if we all drive towards the same direction. So the call here, let's work together to bring this positive health impact with the acceleration of investment in digital health, for instance, or accelerated investment on health in general, because health is at stake here. I mean, this pandemic, we see that there's no private sector that will gain because they believe that the pandemic is not affecting them. It's affecting everyone. So health is key. So investment in health in general and investment in digital health, it's key to accelerate those SDG targets, but also to create that environment that we are used to, of a normal environment. Today, it's very, I miss going to a restaurant and have a coffee with a colleague, and which it's been 9 months. I cannot do that without thinking that I got COVID just because I venture one day to do that. So let's work together. Let's work together to improve early warning systems for disease surveillance, or to make sure that next time around we do better, to make sure that we have a model, predictive models that we're using the power of digital to bring those health benefits, including early warning systems on disease surveillance. Let's help low and middle income countries to navigate and invest and being able to implement those e-health strategy, digital health strategies, but also to drive that transformation at the community level, local level, national level, to ensure that we leave no one behind as we all sign up when we sign for the Sustainable Development Goals, where we agree that we will not leave anyone behind. From WHO, as you said, Dennis, we are building this network of networks. So join us in this network of networks to make everything that I just said, and some of you said as well, possible. And we want to make sure that entities that we normally didn't deal with, such as private sector, we had challenges to deal with private sector because of the conflict of interest. Now we have a framework of engagement with non-state actors that allow us to actually engage with private sector. And we had a contribution of 40 companies on 60 work streams on tech companies that support WHO during this pandemic. So let's take that to the next level. Let's make sure that we together drive the transformation of healthcare in such a way that we beat the other sectors. Because today, financial sector, education, they're all ahead of health. So, and health is so critical to every one of us. So let's do better. Thank you.
Brilliant. Thank you, Bernardo. And so from Beijing, George, thanks a million for joining. It's late for us. It's 10:30 in the evening here. We both know, and you just got off a plane. So George, really appreciate you joining. Joanne from Ireland, Florence from Paris, Bern, are you in Erlangen or are you in Berlin? In Erlangen, which is the headquarters of Siemens Healthineers, and Bernardo, of course, from Geneva, and hello to everyone in Berlin. Again, thanks to Julian and all the organizers of World Health Summit, and what an extraordinarily rich session, and we're going to follow up. Thanks a million, and good night.
Thank you.
Thank you. Bye-bye.
Thank you. Goodbye.
Bye.